We can call it meeting number 2. We call it meeting number 2, but it's actually, I guess there's meeting number 2. The other ones were 1 and 1A, I guess we could say. This is the follow-up meeting to our previous meetings and to all the assessment and information data gathering we've been doing since our first meeting. And the idea of this meeting is part of the planning process of the Mental Health Services Act. And we want to take what we've received, report on what has been found, and have a discussion about that with you all in the community. Again, I really appreciate you all being here. It's nice to see the folks at the centers that are here, that are participating. It's nice to see members of our Behavioral Health Advisory Board here, people from other departments, a lot of people in the community, which we really appreciate you taking the time to be here. This is really, I say really again, I guess I say really a lot. This is really an important meeting for us. Your participation is paramount. It really guides the direction of where the planning process for the Mental Health Services Act and its services go in our community. So again, thank you for being here. And I'm going to turn the time over to Aditi, who's our consultant from RDA and has been greatly assisting us in this project.
Thank you so much, Scott. And hello and welcome, everyone. As Scott mentioned, my name is Aditi Das, and I am with RDA Consulting. We're a research and evaluation firm that's based in the Bay Area, and we are and have been working very closely with Lake County Behavioral Health Services for a while now. So we're very excited to be here with all of you. And again, thank you so much for being in attendance. So I just wanted to kind of provide a little bit of an overview and kind of pick up where Scott just sort of mentioned in terms of where we're at with this community planning process and the 3-year plan that we're putting together for Lake County. So as Scott mentioned, this is the second community meeting. After many of us, if you all recall, we sort of convened back in February. We were really grateful for everyone who was in attendance and participated at our last convening in February. We really want to acknowledge that, coming out of the first meeting, we had some learnings, and we really wanted to listen for some of the concerns that were raised by several of the community members. So one of the things we've tried to do for this meeting is really try to make those materials accessible and available ahead of time. You should have all received an email this past Tuesday with obviously the reminder about this event, and also the slide deck that I will be walking over today. So hopefully that, and that's also been made available at the centers. We have paper copies of those. So I really hope, folks can have access to that, and you can kind of follow along as we move through this process. In addition, we wanted to sort of acknowledge that, and really thank folks who have made the meeting today. This hybrid meeting format is always a little tricky, and it's not necessarily easy for everyone. So we want to let you know that we hear you, and we completely understand that. And we're trying to do our best in terms of accommodating folks' needs. And we see you, and we really deeply appreciate your presence and would love to encourage your active participation. There are going to be moments in the conversation today where we've really crafted a lot of time for open discussion and conversations, and we would love to invite your participation here today. So I also wanted to kind of just provide an overview to folks who are at this meeting today, to kind of give a sense of who are the sort of stakeholders we have amongst us here today. So, we have multiple stakeholders, as you might have sort of gauged just looking at the introductions, as well as the sort of screen names that you see up here on Zoom. We have, I really wanted to sort of begin with the peer support centers. We have folks I see from the Circle of Native Minds, Big Oak, Lavos, and Harbor. A very, very big thank you, especially to the peer support facilitators. You've been really sort of holding fort and helping us have these conversations and set these up at the Peer Support Center. So we're very, very grateful for that. What might be actually really helpful is if I could request the peer support facilitators, if they could kind of go one by one and just really give us a sense for how many folks are sort of there at each of the centers and sort of what the mix of stakeholders look like at each of the centers. So could I request folks from the centers to just kind of come off there, unmute themselves and just kind of give us an overview of who's participating. Would you like me to call on? So anyone can begin. I'm really okay with that. I see Edgar. There we go. Go ahead, Edgar.
Oh, hi, can you guys hear me?
Yes, we can.
Okay, so hi, I'm Edgar Ontiveros.
Hello.
Prevention specialist. And we're here at the Latino Wellness Center. There's only 5 of us, and we're waiting for about 7 more people that will be joining the meeting. So hi to everyone.
Wonderful. Thank you so much, Edgar, and welcome. Thanks so much for your participation. Great. I also see that we have the folks from the Harbor group. So I was wondering if you want to, yeah, go ahead.
Sorry, my setup is a little weird. It's on my computer and our smart screen. So if you see me looking in 2 places, that's why.
No problem.
Right now we've got 1, 2, 3, 4, 5, 6, 7 people in the harbor, 3 of which want to be left off camera. But yeah, 7 youth in attendance and 3 staff.
Wonderful. Thank you so much and welcome. I also see that we have the Circle of Native Minds group. Would love to hear from them. There we go.
Sorry. Hi. It's just me for now. My name's Tony. I'm just waiting on our people to get dropped off, so I'm not sure how many we'll have today, but we are waiting on a few.
Okay, that's great. Welcome. Thank you so much. Are there any other groups? Do we have anyone from the Harbor here?
We just did the Harbor.
Oh, sorry, we did the Harbor. Sorry, the Big Oak. The
Davey
Big
and
Oak.
Big Oak.
Yeah, Davey and Big Oak. I think I saw Davey come on. Davey, are you there?
They had camera issues. I know. Maybe.
I see.
So this is Carrie.
Yeah.
They were having some technical difficulties, but I think he said that they had like 6 there and that they were waiting on more. So
Got it. Thank you so much, Carrie. Thanks for that. And then whenever they can log on, I'm happy to hear from Davey himself. So thank you so much. Well, that's great. So in addition, I also wanted to pay a nod to the fact that we have several program and agency partners who are here along with very key sort of LCBHS agency staff. You just heard from one, Carrie, and of course Scott is here too. Again, I just want to reiterate that we're very, very grateful and thankful for everyone who made the meeting today. We have learned so much. Hopefully folks who are present here today have had an opportunity to participate in the multiple sessions that we've been hosting. We sort of kicked off a lot of this planning process with the launch of the stakeholder survey. We will be presenting a lot of that information today. In addition, we had scheduled some focus groups with both consumers and providers, as well as we hosted a community listening session. So we are very, very grateful with the sort of really very valuable insights and feedback that we received from everyone today. Unfortunately, given this sort of sheer number of folks in the room, it will be hard. I wish we could sort of do a round robin of introductions, but I think in the interest of time, I do need to move us ahead. However, I would really encourage folks to use the Zoom chat function. And so as you can kind of see up here, if you're online, it would be great if you kind of just introduce yourself in terms of your name, your preferred pronoun, what kind of program affiliation you represent, as well as if you're a consumer and provider. We are, as I mentioned at the beginning, we're going to get into some breakout groups and discussions, and we will have an opportunity to introduce ourselves in those smaller group settings. So I hope that's okay with everybody, and really bear with us because we do have some content to go through. So again, just want to reiterate and thank everyone for being present here today. And feel free to continue using the Zoom chat function as well as raise your hand. We'll just kind of get into some of that as I move through the slides. All right. So let's actually begin with what the agenda is for our meeting today. The other thing I wanted to also mention is I just about sort of am getting a little better. I've been suffering with a sort of sore hoarse throat for a little bit, so I apologize if I'm not very clear. I'm going to do my best, and so please do bear with me. I'm going to be as clear as I can be. So in case things are not very clear, please continue to chime in the chat, and we'll have my team help out. So thank you. All right, so let's really get into the agenda. So the agenda for today, we are going to kick off this conversation very similar to what we did at the first meeting, is to provide the MHSA training and education, which really provides an overview of what MHSA is and sort of what those different programs are within MHSA. In addition, we will be kind of talking about just really what this 3-year community planning process has been. I just kind of described some of it in the previous slide. So just know that this section, we will have to speed through this a little bit, again, in the interest of time. Do know that, this information is really available. There's a lot you can learn about MHSA. There are a lot of resources that you can tap into. And so, this also might be a little repetitive for folks who have been through this session. So I apologize if that's the case, but we definitely want to sort of make sure everyone is oriented and is aware of what the MHSA program is. In addition, we're then going to, the bulk of today's conversation is going to be our report back of the community needs assessment findings, which really has been, all of your extremely valuable feedback and inputs that we've received over the past few months. And we've kind of put that together, and we'll be presenting that to all of you today. And in addition, we're going to allow for a discussion around, and we'd love to get your reflections and thoughts on what you heard from the community needs assessment. In addition, we're going to then move into the proposed strategies report back. And really, strategies in many ways are the kind of action steps or things you'd like to see Lake take on moving forward, in terms of whether there are things that are currently working well, which you'd like to expand upon, or areas that, there's sort of identified gaps in what Lake can sort of do about it. And so that's the piece where we're again going to kind of get into a robust discussion, and we're going to get into smaller breakout groups. So as it relates to the agenda, we have 2 key objectives that you see up here on the screen. The first one is, as I mentioned, it's really a review and a discussion of the needs assessment key findings. In addition, we are hoping to identify some potential strategies and think about just program changes to better address some of the needs that you see coming out of the needs assessment analysis. So that's sort of the main 2 objectives of our conversation today. So if folks have questions or concerns, please feel free to continue to use the chat functionality on Zoom, or do raise your hands. And so these are just a couple of meeting tips. As I mentioned, we have a coordinator on site at each of the peer support center groups. And so again, thank you so much for their assistance on this. If you're joining us virtually, do try and find a quiet, distraction-free location if possible. I know this, with the weather being what it's been kind of tricky with internet and phone access. And so we completely understand. And I really hope everyone's been keeping well and safe. In addition, if you have any sort of substantive comments, questions, or feedback, please raise your hand or enter your question into the chat. And even if you're attending in person, raise your hand, and then we can have one of the on-site coordinators let us know what that question is, or even you can feel free to use the Zoom chat function and type in your question. So related to meeting tips, again, different ways of how you can contribute to the discussion. We have the participant icon, which is at the bottom of the screen, where you can select the raise hand function. For those of us who are joining us on the phone, there is a raise hand function. If you press *9 on your phones, we should sort of get prompted. I will do my best, and my team will chime in to see as and when there are questions or folks have raised their hands. Again, want to reiterate the use of the Zoom chat feature. Please definitely continue to use the chat and chime in. And in addition, we have Scott's email up here. So any kind of substantive comments, if you'd like, please definitely post them via email. All right, so I hope folks are ready to begin. Any questions? Oh, go ahead, Scott.
I do have one thing. I wanted to go back a few slides. You don't have to literally, not literally, but
Okay.
Under introductions. I did want to introduce Stephen Carter, who's online. He's our new interim behavioral health services director, and I thought this would be a nice time to introduce him to a community meeting here with a lot of folks that are interested in behavioral health. I don't know, Stephen, if you're
on that note, I'll just say I'm Stephen Carter, interim behavioral health director. I'm also the assistant county administrative officer for the county. Hello, everybody. I will meet all staff and community as I can.
Thank you very much. Just want to make sure we did that. That was a great opportunity to get you out there in the public. Go.
Thanks.
Sorry, you go ahead.
Awesome. Thanks, Scott, and welcome, Steve. Thanks for being present here today. All right, so I'm going to just kind of get into our first section of the presentation today. As I mentioned, this is about the MHSA Act, and it's sort of the training and education component of our presentation. So just to provide folks an overview and background of what MHSA is, so as several of you might be aware, this was Prop 63 that was passed back in 2004, and it's essentially the 1% tax on an income over $1 million. And really the impetus and focus of MHSA is to expand and transform the mental health services, especially sort of in the public realm. And so related to that, you see these sort of 5 buckets here today, which are these really critical pillars of what MHSA entails. MHSA in many ways is very much focused on wellness, recovery, and resilience. Client and families are really at the heart of MHSA, and it's a lot of the service delivery is driven by the client, consumers, and their family members. The services have an eye on cultural competency. The services are meant to be really sort of integrated, and there's a lot of care coordination that happens within MHSA. And the biggest piece of this is that it's very much done in conjunction with the community members, and that collaboration is key and critical as a part of sort of MHSA. So related to that, there are these sort of different funding buckets of what MHSA is. And so you can see here that more than half, like the largest chunk of the MHSA dollars are sort of apportioned to the CSS funds, which stands for Community Services and Support, which is very much focused on the outreach and direct service provision for folks who are dealing with serious emotional disturbances or serious mental illnesses really across the age spectrum. In addition, we have the PEI fund, which is called Prevention and Early Intervention. About 20% of that is allotted to PEI. And really the focus of PEI is sort of on prevention of the onset of some of these mental health symptoms. In addition, you have 5% of MHSA funds allotted to innovation, which is really focused on testing out new approaches and seeing what are some innovative ways of how to improve mental health outcomes. In addition, we also have WET, which stands for Workforce Education and Training. A lot of this work is really carried out by the MHSA workforce, and it's sort of critical. It's a critical piece of this process. And then we also have CFTN, which stands for Capital Facilities and Technology Needs, which is focused on the kind of infrastructure supports in terms of the EMS system, the kind of mental health facilities, the buildings that we have. And so these are all just sort of the breakdown of what MHSA entails. So right here, you will see that, we have listed out the entire sort of gamut of programs that fall within Lake County's MHSA programs. I won't kind of go down this list, but I'll keep the slide up for about a minute so that folks can get familiar with really the array of services and the kind of programming that is provided within LCBHS. And also just a quick plug and reminder that, at our first session back in February, we actually had an opportunity for almost basically everyone. We did hear from every one of these programs in our February meeting, where they gave us an overview of what they're working on, what seems to be going well, what are things that they'd like to see improve. And so this is sort of the list, as you can see, kind of across the different buckets of CSS, PEI, INN, CFTN, and WET. So just kind of wanted to put the slide up so that folks can, again, just familiarize themselves with the gamut of programs that fall under MHSA.
And I think just to add to that, just a couple little pieces of information under the community services and supports. You notice that the third one down is full service partnerships. By regulation, half of community services supports is dedicated to the full service partnerships. And under prevention and early intervention, half of the programs need to be serving youth. Youth is defined as 24 and under.
Thanks, Scott. And the other thing I also wanted to mention, as Scott was talking about, that is with both the outreach and engagement and the peer support centers that you see under the CSS bracket, they receive funding from both CSS and PEI. So it's sort of about a blended funding model for those particular programs. I also see that Patty dropped in the chat recordings of all previous sessions. So you can very much access this, especially if folks would like to learn more about what each of the programs have been doing. We do have the recording and the slide deck available. All right, so I'm going to move on. So again, just to reiterate, we have a lot of background information about MHSA. So we have a lot on the LCBHS MHSA website. So please feel free to look at this and learn more about the MHSA program, because there are a lot of materials available. All right, and my colleague just dropped the same link in the chat, so feel free to look at that. Great, so moving on from the MHSA piece, I did want to kind of talk about what the 3-year community planning process has been, and really just walk you through some key timelines and benchmarks that we're trying to hit as we move through this process. So the purpose, as you can see, of this 3-year plan is very much centered on identifying what have been some of those persistent mental health service gaps, as well as really thinking about strategies to address some of them. And really, we're trying to sort of adopt a more long-term lens, which is a 3-year lens in terms of, because this is a 3-year planning process. So it's really us thinking long and hard and sort of thinking ahead about what we'd like to see change moving forward. And so some of the pieces around this include, we had the program status and service accomplishments, especially that happened over the last year. We're thinking about some of the proposed program plans for the next 3 years, as well as what those changes might look like as soon as this fiscal year. And so it's definitely an ongoing iterative process where a lot of you have been involved, and we're again very thankful and grateful for your engagement. So this community planning process, as I mentioned, is really focused on trying to sort of have a very meaningful engagement with key stakeholders, because we really look to the stakeholders as being the subject matter experts of MHSA, and really want to use your thought process and thought partnership on developing these plans, which are focused on utilizing the MHSA funds at the local level. So really, a lot of this community planning process is community driven and community led. Just a quick note about the PEI evaluation reporting. So in addition to, as I mentioned, because CSS is a bulk of what MHSA programs kind of fall under, there is an additional reporting we need to provide around the PEI programs. The overseeing committee sort of updated some of these reporting requirements, and really under our the sort of PEI annual report, which is what we will be reporting this year, it kind of just really gets at some of those key pieces, which talks about the sort of consumers that were served, what that sort of demographic spread looked like, as well as really program accomplishments from the previous fiscal year. We will also be talking about specific program implementation and outcome information, kind of based on the PEI service area. For the PEI 3-year evaluation report, it's a sort of very similar in terms of what the report captures, but the focus is looking at the previous 3 fiscal years and kind of what the status of PEI has been. And for this 3-year plan, we will, as I mentioned, include the annual PEI report, because the other thing you should all note is that, LCBHS has been working very closely with all programs to strengthen some of the data collection and outcome reporting efforts, and specifically on the PEI programs. And so, that was a change we sort of recently introduced this last fall. And so programs have been working really wonderfully with some of those new reporting requirements that we've been working with them closely on. So that's a little bit about just what the PEI evaluation reporting is going to be. This slide really gives folks a sense of the kind of the wide range of MHSA stakeholders who we have. A lot of folks who are present here today. So really, this list is focused on anyone who kind of touches the mental health system. So it's right from our sort of consumers down to some of the agencies that LCBHS partners with, like social service agencies or education departments, amongst others. So this is just sort of give you an overview of the range of stakeholders that we work with. In addition, I wanted to kind of highlight some of the key roles and responsibilities that we have folks play as a part of this MHSA, especially the community planning process. As I mentioned, stakeholders, we're very much leaning on all of you in terms of your sort of lived experiences and understanding of MHSA and the behavioral health system within Lake County. We have the Behavioral Health Services Department, with Stephen, Scott, Carrie, Patty, some of the key members who have been a part of this, who are really the implementers of the programs. We have, in addition, the Mental Health Advisory Board, who are, providing us that sort of necessary review and advice with respect to the 3-year plan, and will be conducting the actual public hearing process. We have the Board of Supervisors, who will eventually sort of review and approve the 3-year plan. And then you have us right here, where we're just really helping facilitate a lot of these conversations and assisting LCBHS with the development of the report. As I mentioned, I just wanted to kind of give folks an understanding of our entire sort of timeline. And so as you can kind of see, the third section, which is highlighted in green, and we're kind of in phase 3, which is the program planning piece. So what we did coming out of the previous phase is as I said, we had an opportunity to really meet with and speak with a lot of the stakeholders who were in attendance and participated, and we gleaned from their insights, and we've synthesized that stakeholder input. And it was very much focused on talking about needs and services. And so this meeting is really to provide that report back of what we've heard from the needs assessment phase. Moving on from this phase, we will then get into the development of the 3-year plan, and it will be publicly posted. I'll talk about some of that towards the end of our presentation. We will be hosting another public hearing, which is a forum for inviting folks back into the conversation. And then we will be finalizing that 3-year plan and present it to the Board of Supervisors. And as of now, we're looking at end June as our timeline to complete all of these activities. So this kind of brings us to the end of the first section of our presentation. I did, as a part of MHSA, we are required to sort of launch a stakeholder poll, which I'm going to do in a minute. And so just know that, this poll is really focused on trying to sort of understand if folks have a sort of a more or less a relatively reasonably good understanding of what was just discussed in terms of both what the MHSA is, as well as what the community planning process entails. So if it's okay with everyone, I'm just going to go ahead and launch the poll, and I would really invite folks to please respond to the poll. So it's launched right now. So if folks can just take a minute to provide their responses, that would be great. Great. We have almost all our folks present here today participating. All right, I'm just going to keep this up for a few more seconds and close it out, and then I can show everyone the results. All right. Okay, great. Okay, so just a very quick overview. It looks like a large majority say that they sort of agree, and we also have sort of a similar number of those who feel sort of neutral in terms of their understanding. And again, just want to reiterate that this information, a lot of it is available online. Please feel free to continue to reach out back to LCBHS as well as us, and we're happy to provide more detail and information about the MHSA and the community planning process. So thank you so much for your participation in the poll. I'm going to stop sharing and just kind of move us into our next sections, just in the interest of time. All right. All right, so this is section 3, which, as I mentioned, is very much focused on the community and stakeholder needs report back. What we will do is provide sort of talk about the different data sources that we use to pull together this needs assessment process and really bring that back to all of you, and then really open it up for discussion, because we'd love to hear your thoughts and reflections on what you just heard in terms of the needs assessment findings. All right, so this slide, and I also apologize if this feels overwhelming. I will kind of take a little bit of time and walk through the different pieces. So do bear with me, and feel free to ask any kind of clarifications or questions in the Zoom chat or raise your hand. But this slide really, what it does is it provides us an overview of who were the sort of folks who actually participated in this needs assessment process. As I mentioned, we just kind of completed that phase. And so you can see here that, especially looking at the table on the left-hand side, I'm going to start there, where we had about a total number of 234 individuals who participated in the community planning process. And this is really till date. Also, the quick note on that number is that, in some cases, the number of individuals is duplicated because we had some individuals who participated in more than one activity. So just know that that's sort of an estimated total number, which in my opinion is really great, because we've been trying to improve our numbers over the years, and so we're again very grateful that our number is this high at this point in time. And then just kind of thinking about who, these are the sort of different activities that you see that we were sort of engaged our different stakeholders. We launched, right, looking at the first line on this table, we had the community survey that we sort of left open for about 2 months, and we had 108 people respond to that survey. We hosted our first community meeting, which was in early February. We had about 83 folks who participated in that meeting. In addition, we launched our community focus groups. And this is again in February. We had 2 provider groups where we had about 12 participants. We had 2 consumer groups with about 10 participants. And we also hosted a community listening session with about 21 participants. So that's kind of where the 234 number gets broken out. In addition, what you see here in terms of the graph is just really gives you a breakdown of the wide range of stakeholders and like who, what sort of their affiliation looks like in terms of their participation. So about 30% of folks were identified as behavioral health service providers. About 21% were both consumers and family members or loved ones of consumers of behavioral health services. And we had about 33% who identified as other community stakeholders. Some examples of other community stakeholders included medical and healthcare providers, consumer advocates, social service providers, educators, amongst others. And then we had about 29% who didn't actually report their affiliation. And so that's just kind of what those numbers look like. And also you might kind of see that, these percentages don't necessarily add up to 100% because what happened is some folks identified as multiple stakeholders because we did allow for that, especially in the forms that we distributed in the stakeholder survey. And so that's just something to note in terms of the math in case folks are wondering. So this just kind of gives folks an overview of who participated in our needs assessment phase. Scott, did you want to add something?
No, I was
Okay.
doing the math in my head, sorry.
Okay, no problem. So again, just to reiterate, we're very, very grateful for folks, all of this input, and we're very happy with the folks who turned out and responded to the different data collection activities that we had these past couple of months. All right, so we want to kind of start off with just giving folks a sense of what were some of the key takeaways from the survey findings. I know there's a lot going on in the slide, and I will kind of walk through all of these different pieces. Hopefully folks also have access to the slide deck and you can kind of follow along. So, as I mentioned to you, just from the reading off of the previous slide, is we had about 108 individuals who participated in the community survey. And also just note that with the 108, not everyone responded to all the questions. And so this is kind of, a representation really across folks who did respond. And so in the community survey, we included about 13 Likert scale questions where participants were asked to rate how true various statements were with regards to their experiences of MHSA services within Lake County. And so the Likert scale questions, as you can kind of see up here on the screen, range from very true to mostly true, a little bit true, not at all true, and don't know or not applicable. And so those were sort of the range of responses that we elicited from our survey participants. In addition to the sort of quantitative numbers, if you will, in terms of the responses that we gathered from our stakeholders, we also had 5 open-ended questions, and we actually analyzed that data as a part of our qualitative piece, which we will present right after this. And so note that some of that information is going to be in some of the sections that follow this depiction of data with respect to graph. So sort of broad strokes, one of the sort of big, if one were to sort of look at this, and when we looked at the data really holistically, there is a theme that's sort of emerging wherein a lot of the survey participants generally do not feel that existing services are sufficient to meet the community's needs, and in some ways can also be difficult to access. However, the big caveat in that is that when participants are able to access those services, their experiences have generally been positive. So I think one of the big takeaways that you can kind of think about with respect to the survey is that, access and whether services are sufficient is always sort of continues to be a little bit of a barrier. But once folks are in services that are provided by LCBHS, their experiences are positive. So what I'm going to do now is just kind of walk over all of these different bar graphs to give you kind of a sense for what this really means. So if we start up here in terms of, whoopsie, sorry about that. If we start up here in terms of services provided. So overall, under the services provided, you kind of see the range of questions that we asked under that. Overall, about a third of the survey participants felt like Lake County's mental health services are meeting the community's needs. And then over about half of participants felt that it was a little bit or not at all true that Lake County's services help prevent the development of serious mental illnesses and services meeting the needs of people in crisis. So that's again an area and a gap, if you will, that sort of continues to persist within LCBHS. With respect to access to services, a large majority, about 73%, felt like the hybrid service model has helped improve access to services. And so it appears to be that this sort of virtual hybrid world that we're operating in seems to be beneficial for a lot of the participants. About half the participants felt that they knew who to call or where to go for mental health services. However, a lot of participants also felt that it was very difficult to get an appointment when needed. So again, kind of speaks to the barrier in terms of getting hold of that immediate sort of assistance and appointment as needed. 53% also felt like services are available at convenient locations, but about 42% felt that services are available at convenient times. And so there's again some sort of scope of improvement in terms of providing more access and making services that are more convenient in terms of service provision to consumers. And then finally, kind of coming down to the service experience section, a lot of, as I mentioned, a lot of survey participants had overall sort of positive perceptions of what those LCBHS services looked like. About 60 to 65% of those participants felt that it was very or mostly true that LCBHS services are welcoming, respectful of clients' culture, supportive of clients' wellness and recovery, and sort of involves clients and families in their treatment planning. 51%, about half, felt that it was mostly true that providers work to help coordinate services, whereas about 33% felt that was a little bit or not at all true. And then really compared to the other questions, we had more survey participants are likely to respond with the don't know or not applicable to service experience questions, as it's just the way it's been reported in our data. Okay, that was a lot. So I just wanted to kind of keep the slide up and again, know that we have this available and accessible to everyone here. So this is sort of high level broad strokes, what we learned from our survey, which again was about 108 participants who responded to the survey. I'm going to pause for a minute and just ask folks if they had any clarifying questions. Okay, I just want to reiterate, please feel free to continue to use the Zoom chat function or raise your hand if there are any things that come up. So, okay, I'm going to move us along. All right, so what you see here is actually a lot of the qualitative findings along with some of the open-ended survey responses that we posed to participants in our survey. So what we're going to do is we're going to start off with some of the key strengths that we learned about the LCBHS program. Then we kind of get into some of the challenges as well as, just some sort of proposed strategies. And so that's sort of the sequence of what we're going to be presenting to you right now. So to begin with, sort of talking about the strengths, one of the key things that we really heard from a lot of the stakeholders who participated in the qualitative pieces of our data collection were that peer support centers were really highlighted as being, spaces which are conveniently located, as being very helpful and welcoming. And then, the fact that there's been extended hours of operation has really helped improve client access. And that, there is the sort of service motto within the peer support centers is that there's service to all people regardless of their niche. And so this sort of open door policy has been really well received by a lot of the stakeholders. And you can kind of see right here, we have a quote up here from a consumer at a peer support center. And they state that I'm very thankful for the nurturing staff and their consistent guidance on bettering myself and recovering from past experiences. And so again, just paying a big nod to the peer support centers. We've been hearing this, and we had a very similar theme come up at our last annual report. And so peer support centers are being very well received. In addition, there was a lot of conversation around the LCBHS staff and leadership as being very sort of friendly and supportive. Staff were described as being very caring, dedicated, adopting a client-centered approach. There was a special call out for staff with lived experiences because they noted that they have a better sort of rapport that they can establish with the consumers. And LCBHS leadership was also seen as considered very accessible and helpful. Then moving down, we have this piece on service partnerships and collaboration, which was very much focused on open communication and also, and also really addressing to improve some of the staff shortage piece, which we will talk about in the challenges section. In addition, really thinking about how do we sort of prevent the duplication of services and really the ability to refer services for clients, especially if they're not provided in-house. And so that's one of the sort of pieces that we heard from several of the participants. In addition, this accessibility piece is really interesting because, as you might have sort of gleaned from the survey results that, there is an issue in terms of just kind of getting into the door, if you will, or seeking that first appointment. However, services were described as being accessible when certain conditions held true. And so you can kind of see what that means in terms of services were considered accessible when services are seen as being responsive and timely. That's definitely a big piece of that. When transportation is available, then services were kind of considered as being really accessible, as well as when flexibility was being afforded to the consumer. So those were sort of some of the conditions, if you will, that we heard in terms of when services are seen as being accessible within LCBHS. Telehealth and virtual services is definitely something, as you also might have gleaned from the survey findings, is been welcomed by a lot of folks. It has helped to increase the availability of services as well as the accessibility. And it's really helpful, especially for those with mild and moderate mental health symptoms. And then outside of that, we also have some of the programs which we heard were really being well received outside of the peer support centers. Some call outs to these programs include outside of the peer support centers are Motherwise, FSP, psychiatric services, as well as senior peer counseling. We did hear several stakeholders mention these programs. And sort of related to that, one of the other quotes that you see in here is from one of our participants at the community listening session. And they say that, LCBHS has partner agencies. So there's a lot of collaboration amongst agencies and open communication so we can support the needs of the community. So these are, again, some of the key strengths that we heard coming out of our needs assessment findings. Now I'm going to kind of talk about some of the challenges and persistent needs that we kind of continue to hear from LCBHS. And so one of the biggest things that we heard from a lot of the stakeholders was this notion around staff shortage and retention. One of the big things is sort of this limited access to trained or licensed clinicians, even though, peer support staff and some of those, the key personnel within peer support systems have been very helpful. Like, I think there's a level of care that's needed in terms of sort of the clinical intervention that seems to be missing. And then also the fact that, because the staffing has been limited, it in many ways has affected the kind of timeliness to services as well as the quality of care. That was something that was called out by several of the stakeholders. In addition, one of the notions that were sort of identified is that it is hard to recruit providers. And there were several reasons cited. Some of them include things like the kind of pay, the cost of living, location, the choice of location, and sort of, how is that going to be addressed moving forward with respect to staff shortage and retention. In addition, there was a lot of conversation around barriers to accessing and participating services. So some of the service access challenges included things like a lack of transportation, some of the locations of the facilities, Wi-Fi, broadband issues, program closures. A lot of that happened due to COVID or even pausing of programs during COVID, as well as limited hours of functioning, which may not sort of necessarily work with consumer schedules. In addition, we did hear that there is a lack of culturally competent services, especially kind of bilingual services, as well as services that are informed by the history and the specific needs of both the Latinx and the Native American communities. One of the things we learned related to this is that there has been a historical lack of trust among some of the communities, and a lot of the consumers within these communities feel like they're not being heard. And so that's definitely something that we heard coming out of our conversations with folks. In addition, timeliness of services where, long wait times and lack of responsiveness, especially in terms of difficulty to get an appointment was something that was echoed by several of our respondents. In addition, there's, one of the things we also heard was this sort of low level of service awareness and knowledge amongst consumers in terms of what programs do, what they don't do, and what those parameters are within programs. The other thing I wanted to mention is, COVID, of course, has unfortunately continued to have an impact on services, and we've moved to a pivot to virtual services in terms of not being accessible or appropriate for everyone. So even though we've moved into this hybrid environment, it doesn't necessarily work for everyone. In addition, there were sort of these service gaps and a lack of infrastructure support in terms of care coordination, where, some folks talked about just sort of this lack of communication and information sharing within and between agencies, and a need for better coordination with providers that are outside of LCBHS, like the hospital system. These quotes in here, you can kind of see address some of these challenges that I just highlighted. So for instance, one of the survey respondents said that we simply lack qualified staff. We lack the capacity to provide many key services. This creates higher stress on staff who lead for better paying, less stressful jobs, perpetuating the pattern. In addition, we had a consumer at a peer support center tell us that, victims fall through the cracks. Nipoma baskets are woven in a way to keep in water. That is how we should treat our clients. We thought that was a really poignant quote, and we want to kind of add in here, which really highlights some of those persistent challenges that continue to surface. All right, so in the interest of time, I will kind of have to walk over this section a little more quickly because I do want to allow time for more discussion and conversation. So right here, you can kind of see is a list of all of the different population groups who are identified in terms of high needs. So first off, we have the unhoused population where, folks talked about just sort of the lack of awareness and how it is harder to follow up with folks who are unhoused. In addition, there was talk about the co-occurring issues, especially around substance use in terms of limited services and resources that were made available to meet some of these high acuity needs. School-age children and families and parents, a lot of this was due to COVID in many ways, where there's been lowered mental health classroom engagement, as well as higher teen suicide rates that have been showing up kind of across the county. Talking about youth and the Tay Center, one of the things that was highlighted was sort of talking about the transportation issues. So things around how parents have not been able to get off work until 5 p.m., youth not being able to drive. So just in terms of how that poses to be a barrier in terms of accessing services. And will the LGBTQ plus population, there was also talk around just needing safer spaces to feel accepted. The undocumented populations were also sort of highlighted as one of the populations in need. We also had the older adult group where, we kind of talked about some of these access challenges. So the fact that this group is more homebound, they may not necessarily be able to navigate technology or telehealth and find it harder to advocate for themselves. The Latinx community, especially the non-English speaking populations, there was talk around a lack of bilingual services, as well as this sort of historic lack of trust, which I've also brought about. With the Native American community across really all age groups, we heard some concerns around a rise in teen suicide, elder abuse, as well as this sort of historic lack of trust, as something that I've also mentioned previously. And also populations in rural areas. Some of the access challenges include things like lack of Wi-Fi, broadband access, as well as the services just not being conveniently located or easily accessible via public transportation. And then in addition, with perinatal and postpartum moms, one of the key pieces we heard with this group specifically is that they experience a lot of isolation due to COVID. And that, you know, their mental health needs are not necessarily being addressed as much as they'd like. So these are just some of the key populations in need in terms of the persistent needs and barriers and challenges that they continue to deal with. All right, so I think, so given where we're at with time, this is really where would love to really open this up in terms of reflections on what you just heard around the needs assessment discussion. I think we can allow for about 7 to 10 minutes of discussion time before we move into the strategies piece. And so, you know, just would love to hear, I know that I spoke a ton and there was a lot that came your way. Hopefully folks, as I mentioned, may have had a chance to look at some of these materials ahead of time. We're just curious to know if any of these findings resonate with you. Were you surprised with any findings? If so, what surprised you? And are there any key needs that weren't captured? So would love to open it up. So feel free to chime in the Zoom chat as well as I see Samantha raises that these are the same findings and discussions that came up in the CHIP conversations. Okay, thank you for bringing that to our attention, Samantha. Any others? Would really love to hear, and I'm happy to move back to any of the slides if folks have specific questions as well.
Where do I have that right now? Well,
Christina, go ahead.
Good morning. I appreciate that overall assessment. And as I enter my new role at Sutter Lakeside Hospital, what resonated with me and what was spoken was the need for better care coordination to help our vulnerable populations navigate the systems that we have in place. I think that at times there are structural barriers that we're not aware of that are navigated with care coordination, whether it be filling out forms or helping people make the calls or set up the appointments, because at times even the simplest things can be structural barriers to our vulnerable populations.
Very important point. Thanks for raising that, Christina. Julie, go ahead.
Hi. One of the things, a couple of things were noted on our data notebook this year that we report back to the state each year. And one of those was a significant need for a closer or more local residential treatment program, and an increased need for both for mental health challenges, diagnoses, and co-occurring those, especially those regarding substance use disorders. And that was something that we heard directly from both stakeholders and consumers that was a vital need really here, whether it's more just something closer. But the other thing that was noted was coordination with the clients when they are hospitalized, the acute care needed, the urgent care needed prior to hospitalization, and follow-up and coordination after release from a hospitalization was really a challenge. And that came from providers working with clients both before and after 5150 type hospitalizations that have happened, and trying to coordinate for care and follow up. So those were a couple of things that I don't really feel were reflected quite in the information you have there.
Julie represents the Behavioral Health Advisory Board.
Okay, great. Thank you so much, Julie. Very important insights. Thank you.
Thank you.
Kim, go ahead.
Hi, thank you. Yeah, to Samantha's point, Scott, I know that we got you in on the Hope Rising meetings there for the CHIP. And I'm wondering if there was any thought to bring people from that group to this group, just to really fully weave together the, the plans and the efforts that are being laid out for the futures. I think it would be a good idea. Just my idea.
Well, I am going to the CHIP groups as well. But yeah, this is definitely open to the whole community.
Thanks, Kim. Any others? Any other thoughts? I mean, folks from the peer support centers, we're just curious if you had any reflections or thoughts as you as we presented the findings. I'll just wait for Bowden, if he's just a couple of maybe 30 seconds or so, in case we don't have more responses. I'm happy to move us into our strategies section.
You can also put responses in the chat too if you're
exactly
shy of speaking.
Exactly. Please feel free to do that. Oh, I see something. Okay. So just to note that, I think in the interest of time, we should sort of move on, because we do want to talk about some of the strategies and actually turn it back to Lake to talk about some of the past strategies that Lake's been involved in. And we will have an opportunity to talk about both the needs assessment findings as well as some of the strategies in the smaller breakout groups. So hopefully that will give folks more of an opportunity to chime in. So I'm going to move us ahead. All right, so we're kind of talking about the strategies report back. And so, do note that these were, in a lot of our line of questioning, we asked folks around what they'd like to see change and improve, or what they'd like to see expanded upon. And so these are the different sort of brackets that we learned from our needs assessment findings. So I'm going to kind of move through each of these columns and findings and really highlight some of the key themes that we heard coming out of the needs assessment process. So to begin with, there was a lot of talk around, around sort of increasing service awareness, outreach, and access. One of the key things being sort of improving staffing. So there was a lot of talk around introducing a sort of a behavioral health systems navigator and sort of a point person, as well as having more community health workers, especially geared towards working with more underrepresented communities, especially the Native American community. In addition, there was a lot of conversation around addressing transportation barriers. So this could include things like gas vouchers, actually having sort of outreach vans being accessible, made accessible to consumers in terms of improving access to services. There was talk about increasing outreach and awareness in general, sort of having more county-wide informational meetings or town halls, providing additional telehealth supports, because, there's still continues to be a little bit of a barrier for some folks, especially some consumers. Improving convenience of location. So this includes things like having satellite clinics or offices in more convenient locations, more home visiting options, amongst others. With respect to service coordination, one of the key pieces we heard was just this idea of improving communication really between agencies, because this is an integrated service model with a lot of care coordination, and that's really been critical to a lot of the service delivery and access issues. And so, especially sort of thinking about staff transitions or the new EHR Cal AIM that's kind of happening around us, and sort of how best can we sort of use that as a way of improving that communication between agencies. Adopting databases to track clients, so things like ECM and the Pathways Hub. I know those are, again, things that are happening within Lake County, and sort of thinking about how do we sort of really best capitalize and work with that. And really, avoiding silos and aligning with CHIP and other initiatives like Hope Rising. I know that was raised in the chat and folks have been talking about this, but really this is a moment where there's a move towards bringing about that stronger alignment. With respect to workforce education and training, some of the things that were raised included things like providing workforce incentives, which is, how do we sort of incentivize staff to stay? It's really kind of trying to solve for the retention issues. So, for example, things like helping paying off student loans, providing more flexibility in terms of remote work, adding bonus structures to staffing, so those are some of the considerations. The other piece around this is really this idea of growing your own staff, which is, how do you sort of build capacity within Lake with folks who are from the county and from sort of areas and neighborhoods around the county, which include things like implementing more trainings to build off of staff experience, leverage what's already in place, and really help staff move up the ladder and kind of give them a sense for what that professional development and growth might look like within Lake County. In addition, also this idea of provision of culturally competent training, especially engaging with the Native American community. We heard that a lot from folks who belong to that community, that, we could actually have the tribal community folks provide these trainings, as well as provide resources and materials on cultural and awareness, cultural considerations, as well as provide some of that history and context, which is really key. Moving on to some other proposed strategies, there was a lot of talk around the need for really this consistent funding in terms of making programs and services a little more dependable. Things like we heard about the warming centers, after-hour services, because again, that continues to pose a barrier for some consumers, as well as sort of improve technical assistance, organizational capacity, as well as expand building and facilities. So that's, a piece that we heard from our different stakeholders. In addition, sort of see this long list right here around the need for new services or expansion of existing services. So one of the key pieces around that was this notion around prevention services, that it really needs to, we have to shift the focus away from crisis response to crisis prevention. And I think that's really been a big move and a drive. And also in doing that, the prevention and outreach needs to be provided to almost all kind of types of groupings. So this includes folks in sort of the students and teachers, folks in the unhoused populations, those that reside in rural areas like the farm workers, and sort of really where is that sort of expansion and that prevention lens that's being sort of adopted. In addition, with respect to crisis response, there was a lot of talk around the mobile crisis team. And there were some considerations that were sort of brought to bear. So this included things like ensuring that there's sort of gender representation on staff, especially with respect to the crisis response team. And really crisis teams in many ways needing to operate as really an independent entity that's a little separate from prevention. And in doing so, there's a need to identify more innovative funding streams, because I think there's been a lot of excitement and encouragement towards the mobile crisis unit and team. And so these are just some opportunities to build and flesh that out more. With respect to youth services, there was talk around the expansion in terms of the range of youth support services and mental health school outreach and what that might look like. Like I said, a lot of this was stopped and paused due to COVID. And so a lot of it is sort of talking about the resumption of that effort and work. In terms of adult and older adult services, there was talk around the provision of additional adult FSP programs prior to the onset of a crisis situation, which is really sort of critical. Expansion of case management, but that was another point that was raised. Oh my goodness, I'm so sorry about that. This is really what was interesting about this point in terms of expanding case management is talking about this addressing of gray area of identified services, because one of the things we noted in our findings was that there was some folks who sort of was showcasing mild to moderate and moderate to severe mental health systems. So kind of falling in that in between mental health symptom continuum. And so what does sort of case management mean for that subsection of the population? There was talk around the expansion of more co-occurring disorders services, because there is a need for that within the county, as well as the growth of both postpartum and perinatal services. In addition, you can see that there are some other system needs that were highlighted within the proposed strategies. This includes expanding SUD services, improving access to basic needs. Oh, hi, sorry, did someone want to say something? Oh, okay. Improve access to basic needs like shower services, improve the comfort of homeless folks, really have an opportunity to enhance our social and community events. I believe, again, that was something that was really robust and up and running pre-COVID, kind of thinking about ways of bringing that back. Provision of emergency services, as well as improving the 5150 screening system. Those are just some other proposed strategies that were highlighted. I'm going to now bring Scott in, and really this is an opportunity for LCBHS to provide an update on what some of those past strategies have been and what kind of continues to grow within LCBHS. So Scott, go ahead.
Okay. Here we go. Okay. The nice thing is, as we read through the proposed strategies, LCBHS has kind of recognized the same issues, and has also been trying to address many of these strategies. So I just wanted to kind of give you an oversight, a brief oversight, hopefully, of what we are doing to address some of these already. For service awareness, outreach, and access, we have implemented a much broader outreach program. We've heard, through many of these community stakeholder meetings, the increased need for outreach, and so that has really become one of our growing targets of what we try and do, particularly within MHSA. You might have seen our outreach van that's been driving around the community. It's pretty colorful, same kind of colors that are part of this slide deck we have right here. You can't really miss it, but it goes out all week long to homeless encampments, to people identified in need, and really making a real impact on people's lives. We have things that what do you call them, like hygiene kits and other things that help people during cold winter or hot summers that are good, and a lot of times we have bag lunches and things just to go out and try and find people that are in need, and be able to offer referrals and help them as we can. Just something that's really I'm very proud of what we're doing. We've also strengthened our outreach and engagement program. A few years ago, this community meeting identified that we needed more outreach workers, and so that's exactly what we did. Took a while to get that all in place and hired up, but we now have 5 full outreach and prevention specialists that are out there in the community, whether it's the outreach van, or going into the schools and providing real prevention type of services and mental health first aid and QPR classes, and or reaching out into the underserved populations, traditionally underserved populations, our Latinx populations and our Native American populations. Boy, we have some, and also our older adult population. We have some exceptionally talented people in those roles. I'm just amazed at how we were able to get some great hires in those roles. Just fantastic people, and so that's something that we're really increasing on. We also, let's see, I guess if we can mention this, providing transportation to the warming shelter. Kind of in a broader sense, we're working with the local warming shelter and emergency warming shelter in Lakeport, which is currently housed at the former juvenile detention facility. And our peer support centers have been working very closely with this population already, and also with the shelter. And we try and provide, because it's a warming shelter, it opens at 3 o'clock in the afternoon, starts taking people 3 or 4 o'clock in the afternoon, and then in the morning after doing breakfast and providing a snack lunch, they close up again at 9 o'clock. And so we transport people back and forth, you know, from the shelter during those off hours, and often they come over to the peer support centers and get some support there too. We are developing a mobile crisis response team. This is beyond MHSA, but it's a department program project that we're working on. It's going to be pretty far-reaching. It's a requirement that the state is also implemented as part of behavioral health reform, and so we are in the process of developing it. We have to have our plan complete by the end of the year, and so it will also involve peer support and in our crisis team workers. Another area is service coordination. I'm sure if you have seen me before, you've heard me talk about our Pathways Hub, which started off as our MHSA innovation project, and it's grown beyond that now to receive funding from both our whole person care grant that we received a few years ago, and from our continuum of care for coordinated entry services. So it's a combination. What the Pathways Hub is it's designed to help do a closed loop referral system using electronic health record, or it's not a health record, but electronic software to help with that. And also it does coordinated entry, which is our housing resource specifically. And so it's kind of neat. It's developing, but the idea is that it's getting the different community-based providers working together and having that communication for serving our clients. Utilizing community health worker as that's the Pathways Hub project is really emphasizing the use of community health workers who, particularly as related to, you might have heard, enhanced case management, which is another benefit that the state has provided through Medi-Cal, to be able to offer case management services to providers who traditionally haven't had the ability to do case management. Behavioral health has had case management for forever, but so this is nice. It's allowing other agencies that ability to provide case management. Community health workers are seen as navigators, and being able to help people navigate through the many systems of service providers in our community. And then, of course, we're also always partnering with community agencies, and just a small handful were listed here: Hope Rising, the Housing COC, Housing Navigation Committee. I'm not sure why that's kind of limited like that, but we have a vast network of partners that we work with within the community. I think we mentioned Housing COC right there because, as probably many of you are aware, LCBHS is the administrative entity for the housing community of care. And housing, as everyone knows, is a growing importance and significance within California. services for specific populations. This is something else that we are really striving for. As I mentioned before, we've hired outreach and prevention specialists, and those specialists are associated with our peer support centers who are designed to serve underserved populations to begin with, as well as the older adult population, working with senior centers and some of our other community-based organizations that work with seniors. We've hired a parent partner, which is great because we haven't had a parent partner for about a year. And so she's hit the ground running, and we're excited about that role. She will also be over our family support center, which is now co-located in down in Clear Lake with LaVos. Over these past few years, we've added additional funding for the peer support centers, recognizing that they are kind of like the base for our outreach efforts, and you know, also acting as an alternative means to traditional behavioral health treatment. Some people haven't got to the point where they feel they can do treatment or whatever reason, and so we provide peer support as a valued intervention. Peer support has also been recognized finally by California as a legitimate intervention, and it's being allowed to be a billable service under Medi-Cal. So that's a real growth, and what goes along with that is certification. And so our peer support staff are in the process of all becoming certified, which will be great. As I mentioned before, we have the COC funding for the warming shelter, and we also have county funding from LCBHS through a state grant called HHAP. And of course, we're partnering with the County Office of Education with a program that's called the Mental Health Student Services Act, which is kind of a parallel funding to help provide mental health services within the schools. And so that's a program that was a $2 million grant that we were fortunate enough to be able to receive. So we're working closely with LCOE on that and the state. Workforce education and training and capital facility and technology needs. We kind of put together in one column. Created a guidelines and career ladder for peer support specialists and certification. I mentioned before about how we're doing peer support certification that's necessary, but it's also kind of part of a broader idea of a full career ladder that we're trying to do. It's mentioned on there that the third bullet that we're participating in the regional WET partnership. And what that partnership does, it's kind of neat, is we receive part of MHSA workforce education and training funds. And so we can take some of those funds and put them into this partnership. And we receive matching funds from the state, from it used to be called OSHA. I forgot what they're called now, but they provide matching funds. And with that, we're able to provide to our staff loan repayment, stipends if you're in school, and scholarships if you're in undergraduate school. And it helps people, you know, further their education. We also wanted to do the lower rungs of the career ladder, helping people get into the field, which goes back to the you know, peer support specialist is often an entry-level type of position. So we're helping people to, you know, start from that to grow within our field. This is something, you know, as the Dee mentioned previously, the idea of grow your own. And I've mentioned this numerous times where you know, we believe we're much more successful at retaining employees if they have roots here within the community. And so the idea of helping people that have roots enter the field, grow in the field, start and grow in the field, is something we want to encourage and support. So that's kind of what we're doing with WET. We also mentioned that we hired a WET coordinator, which is nice, and so he's doing a lot of the coordination for these programs. And let's see, we didn't mention within our innovation. We should have put innovation at the top of that column there too. We have an FSP improvement project which we're working on. As I mentioned before, FSP, full service partnership, is 50% of our CCS, so that equates to around 35% of MHSA. And so we're within a partnership or a collaborative, that's a better term, a collaborative with other counties across California, working to improve FSP services. And so that's resulted in kind of clarifying some of the criteria, clarifying on how people graduate from the program, and doing training with our staff in these areas. And then last on their cap facilities and tech needs, bid for grant to bolster existing capital facilities. We do have, we've had funds reserved within cap facilities for quite a while from MHSA, and we are obtaining state grants that also are designed for behavioral health infrastructure improvements, and so we're in the process of obtaining those so that we will be able to finally better our South Shore clinic, which is in need of repair and help and improvement and expansion. So, okay, any questions about what I just said? Or did I put you all asleep? I hope I didn't put you asleep, but if I did, I can understand that. Okay, Dee, I'll turn it back over to you.
Awesome. Thank you so much, Scott. Yeah, feel free to continue to chime in via chat, or please raise your hand. We're happy to address any questions. I just dropped this in the chat. I think, kind of in the interest of time, I feel like there's always so much information we need to get through with these meetings. And so we might have to just kind of skip over the break. I know we had a 5-minute break slated in the agenda, so I hope that's okay with everyone. Please feel free, if you need to take a little short bio break or any other break, please feel free to just do so. I did want us to just kind of get into some of the discussions, because I mentioned that, there will be an opportunity for folks to chime in these smaller breakout groups. So before we do that, I'm looking at my time. We have about half an hour left for this meeting. So we're actually hoping that we can get into these smaller breakout groups for about 15 to 20 minutes, and so that we can kind of, have those smaller breakout group conversations. We will come back, reconvene, and just do sort of a quick report out and hear what we heard from the smaller breakout groups for about 5 minutes. And then I do need about a few minutes to just kind of walk over next steps in terms of what to expect with the 3-year plan process. And so, so before we do that, and before I send everybody into their breakout groups, I did want to just kind of raise the questions that we're going to be posing to all of you. We'd love to really hear your thoughts and inputs. And so the 3 questions here are: what can be done within existing MHSA programs to better improve services for the next 3 years? That's fiscal years 2023 to 26. What are some new strategies that might be needed? And then what can be done within existing MHSA programs to implement these strategies over the next 3 years? So again, as I mentioned, a lot of the strategies discussion is really trying to look ahead and look forward in terms of addressing some of the gaps and needs that we highlighted from the previous sections. And so If it's okay with everyone, I'm going to go ahead and my colleagues just dropped some of this in the chat. I will go ahead and just launch. I'm actually going to stop sharing real quickly so that we can actually see each other, and then I will put us into our breakout groups. Other quick note is we're going to have some of the peer support center folks also be part of those breakout discussions. So feel free to continue to chime in there. Give me a quick second. I'm just manually adding some folks.
So is there any question breakout groups about, it sounds like the general idea is we have these 3 questions and you'll be discussing, the questions amongst yourselves.
Yes.
Coming up with some ideas, and then hopefully, at the end, we can report on some of those ideas. We'll have someone from RDA will be at each group, right? And they'll
That's
be
right.
taking notes of what you're saying.
That's right.
It'll be nice at the end just to kind of compare a little bit.
Absolutely, Scott. We will have a chance to do
We'll
that.
have all the notes, what you said. So nothing you said will be lost.
Yes, that's right. Thanks for bringing that to attention. Thanks, Scott. Okay, I'm going to go ahead and just open up all the rooms so hopefully folks can go ahead and join their respective groups. And remember, we'll spend about 15 to 20 minutes and then come back to a larger group. So thank you.
I think I jumped out of my group too early.
It was good seeing you here. Yeah.
Thanks.
All right. I'm just gonna... Oh, sorry, one quick second. I actually think it's easier to not screen share so we can see folks. All right, welcome back. I know we have a few more minutes. I do think it would be helpful to just do some reflections on what we heard in the smaller breakouts, and then I will speedily move through the next steps. I apologize. I feel like we always have so much to cover and there's a lot of ground. So thanks for bearing with us and being patient. Hi, welcome back. Just waiting. I think there's Jamie's group is waiting to come back.
It will now.
Yeah. Yep, I see them all come back. There we go.
We'll have to, go ahead, keep on.
They don't really want homes around here. That's really a major effect.
Hi, everyone. Welcome back. I think we have a majority of our folks back. So thanks so much for the breakout discussion. I just obviously didn't want to screen share just because I thought it would be a good opportunity for us to see each other for just a few minutes. So if it's possible, could I call on Jamie to give us a little bit of an overview of what was discussed in her breakout group, and then Paulina, and then I can give an overview and we can move from there.
Can you hear me?
Yeah, we can.
Okay. My audio disappeared when I went into the breakout room. So shout out to Carrie for facilitating, but to everyone in our group, I was taking copious notes. So a lot of the discussion about kind of bolstering existing strategies was really about kind of growing and retaining the workforce, since that is trickling down to so many of the other challenges that folks are seeing. So really building those bridges to help people kind of through the career ladder, doing more to help people like even just get their GEDs and kind of get to that first level, and getting people into those kind of lower rungs, making kind of incentive programs more accessible and growing those types of resources. Also just like to help retain folks, really kind of building a sense of community and care and kind of helping people to understand how much they're valued in the local community rather than kind of going to neighboring counties. One of the things that was talked about was that especially with remote work, people can live in Lake where there's a lower cost of living, but then work in neighboring counties like Napa and Sonoma where they'll actually get paid a little bit more. So really trying to make employees valued and not just growing your own, but really focusing on retaining folks. And figuring out like what makes Lake special and what makes these organizations really special to work for. Some of the other things that we talked about were just really advocating for the unhoused population, that there can be like discrimination towards them. So that's one thing. And then also really just kind of making sure that these resources are known. We talked a little bit about the peer support centers as being kind of also a place that can fit into the crisis continuum and letting people know that that's available. So using kind of the PSCs as one of the first places that people can go, and then bringing in the crisis team as needed if it can't be resolved there. And then lastly, kind of also just really emphasizing these community health workers and being able to use them as a bridge into kind of different cultures and belief systems, and helping people feel like they're understood and supported no matter what, and really relying on kind of the community health worker folks to kind of help create those bridges. Anything else that I missed from my group? Okay, and I'll kick it back to you.
That was a busy group there.
Yes, thank you, Carrie, for helping with my technology issues.
Thank you so much, Jamie. Paulina, would you like to give us a little bit of an overview of what was discussed? Thank you.
Definitely, yeah. So there was a lot of talk about the need for more bilingual therapists and counselors. And a great strategy that was brought up is introducing a stipend and just making the wage more enticing to bring in more bilingual folks. And then there's also talk about increasing SED services. I know this is not within MHSA as of right now, but with the changes coming, more SED services for high school and college age youth. And then also in this same age group, as particularly TAY, and then as well as foster youth, having more residential housing options within the county, specifically short-term residential housing. We talked about this a lot, and folks brought up a lot of great points, especially that placing children outside of the county is detrimental to youth. And so having options within the county is really needed. And then lastly, kind of like altogether more communication and agency collaboration. So having leadership mobilize that cross-agency collaboration, improving the ROI and data sharing piece, as well as just integrating also more connections with tribal health and integrating tribal presence in meetings so that everyone can hear about what each other are doing, what services are available, and things like that. So I tried to fly through it, but we had great conversations. So thank you to my group.
That's awesome. Thank you.
Thank you so much, Paulina. Great. And then I can give everyone just a quick overview of what was discussed in my group. I was also just going to say we are at time, so if folks do need to hop off, please feel free to do so. Quick plug is I will be talking about very quick next steps in this process. So if folks are interested, please stay on for a couple of more minutes. But before I do that, I just wanted to give a brief overview of what was discussed in our breakout group. So one of the key pieces, that folks brought up was also this need to really address some of the concerns with the homeless population. There's a large unhoused population within Lake, and especially in terms of provision of access to some key items like hygiene services, warming items, hospice supplies, amongst others. There was also highlight provided to, this thought around providing financial investors for folks who are part of the NEST program, especially given that, they are sort of going through a lot of sort of individual crises situations. And so these are some ways of how to sort of address some of that. There was also echoing a dire need for more improved coordination really across different agency partners. And, how do you sort of think through the cultural competency pieces of that? Because that's always been a sort of critical element and needs to continue to grow. Someone also sort of raised how that, we need to sort of also think about the church and the faith-based communities because their ideas of mental health and healing may differ, and it's a subsect of the population that we actually haven't highlighted in our findings, and so something that was raised. In addition, some new strategies, and we just heard about the HIRE program, which is this huge source of funding that's coming, especially for folks who are justice involved, and how do you sort of streamline and bring them back into the workforce. And so there was a lot of talk about, sort of putting some thinking around working with that particular grant funding and an opportunity to really create this regional coordination and effort really amongst the different providers and facilitators. In addition, there was also talk about how, some of the peer support centers are actually registered mental health specialists who can provide some of this assistance in terms of providing and sort of assessing folks with acute care needs. And so it's almost like an unidentified resource that needs to be tapped into and made more aware of. I see that we have someone from the Harbor with their hand up. Did you want to?
Yeah, so I just wanted to echo off of the HIRE grant. I attended the most recent info session, and there's currently not another one scheduled. So I would be willing to host a Zoom session and present the information to you all. I think that would be a great starting point for that. I took extensive notes on everything and the requirements, and so if people are open to that, you put your email in the chat. I can send you the link to the grant program, to the webpage, and then maybe from there we could set up a meeting for me to kind of not necessarily pitch it, but just present this grant.
That sounds great. Thank you so much for raising that. So I was going to say, just in the interest of time, if it's okay with everyone, I'm just going to walk over key steps. Just note that, this has obviously been recorded, and we again want to be very grateful for all of these inputs we've received from all of you. We will be integrating some of that into our report. So if you can just give me a quick second, I'm going to pull back the slide deck. Second. All right, so I'm going to go ahead, screen share. All right, so just a quick overview of what to expect. As I mentioned, we are now getting into the development of the actual sort of 3-year plan, which is slated for a lot of that is going to happen in April. We will be posting it for public comment in May, and we will be hosting the public hearing in June. So definitely look out for that, but there is going to be more information coming when you'll kind of learn more about the dates. In addition, we would really love to invite any meeting feedback that you might have. I had my colleague drop the link in the chat. Paulina, if you could drop it again, that'd be great. This is really, we'd love for you to take this brief survey. We take the feedback really seriously, and we want to learn and grow and help improve this process for everyone. And then finally, thank you. You can get access to the recording and the slides on this website. We will drop this link. I think Patty shared this link earlier with everyone. If there are any sort of lingering questions, comments, you have our contact information in here. Please feel free to reach out and let us know if we can be of any assistance.
Can you
last? Oh yeah, go ahead.
Can you post that little square scan bar thing again, please?
Oh, yeah, sure thing. Great, and I think that pretty much brings us to the end. Thanks, Paulina. You know, for those who didn't have a chance to complete our demographic survey, we just dropped that in the link. And you will hear from us. We'll make these slides and the recording available. We'll probably be sending out an email soon after with all of that information. So thank you again for being a part of this conversation. We really valued your participation, and we hope to see you all at the public hearing. So thanks and have a great rest of your day.
Thank you. Thank you very much for coming.